Today we're focusing on mastectomy side restrictions for venipuncture, a critical safety topic that is heavily tested on phlebotomy certification exams like the ASCP PBT and NHA CPT. The number one rule you must know is to avoid performing a blood draw on the arm or even the hand on the same side as a patient's mastectomy. The primary reason is the risk of causing or worsening lymphedema. During a mastectomy, lymph nodes are often removed, which damages the lymphatic system's ability to drain fluid from that limb. A tourniquet application and a needle puncture can overwhelm this compromised system, leading to painful, chronic swelling and increasing the risk of infection. Furthermore, the composition of blood in an affected arm can be altered due to lymphostasis, potentially leading to inaccurate test results. Your exam will test this concept using scenario-based questions. For instance, a question might state, a patient had a right-sided mastectomy 10 years ago and has an IV in her left antecubital fossa. What is the appropriate site for venipuncture? The common trap is choosing the right arm because the surgery was long ago. This is always incorrect. The restriction is lifelong. You must not use the arm on the side of the mastectomy. The correct approach would be to ask the nurse to pause the IV and draw from a vein distal to the IV site in the left arm, or potentially a hand vein on the left side, following facility protocol. Now, let's consider a tougher scenario, a bilateral mastectomy, where both arms are restricted. This is a common high-difficulty question. In this situation, you cannot proceed without a physician's explicit documented order. The physician may approve an alternative site, such as an ankle or foot vein. Attempting a foot draw without an order is outside your scope of practice and will be the wrong answer on the exam. The patient giving you permission is also not sufficient, as they cannot provide informed consent regarding the risks. Here is a simple mnemonic to help you remember the core principle: mastectomy away, draw the other way. It's a straightforward reminder to always select the opposite side. If both sides are affected, you must stop and escalate by getting a physician's order. Finally, always remember documentation. When you must use an alternative site, like a hand vein because the antecubital veins are not viable, or a foot vein based on a physician's order, you must document precisely why the alternative site was chosen. Exam questions often include documentation as the final, critical step in the process. While recent research is reevaluating the absolute risk of venipuncture causing lymphedema, current national standards and exam questions are based on the established, cautious protocol of avoiding the ipsilateral arm unless a physician provides written permission. Your job on the exam is to know and apply this current standard of care. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.